Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
The technique called stop and go technique is an old technique, but it works very well. The stop and go technique means what? You're in a relationship right now. You're having sexual intercourse and you're about to ejaculate. I want you to stop and pull out. And the wife will squeeze the head of the penis till the blood in the head of the penis moves away, till she feels the head of the penis empty, not engorged like when he was about to ejaculate. Can this work from the first time? No, it will need a little bit of practice because this is the first few times. So it's the wife who does the squeezing. Is the wife who will understand this is about to ejaculate. Now is my job to do the work so he doesn't ejaculate. That's why communication is very crucial. You cannot hide it and say, no, I'm shy. I don't want her to know. I'm going to do it myself. How are you going to do it yourself if she's involved with you in the act? Tell me that. You cannot. So both of you have to understand this man has a problem, and both of you have to understand and have to work on fixing the problem. And the way to fix the problem is just what I'm telling you right now, the stop and go technique. You pull out, she squeezes the head of the penis, then you continue. And you get the urge again to want it to ejaculate, you pull out, she squeezes the head of the penis, and then you continue. So it takes two, both of you, and you have to have very good communication. And then you have to work on your pleasure. So you have to listen to her, and this is not an insult to you. This is not an insult. This is trying to make the relationship work, rather than you go out there and get somebody else, and she goes out there and gets somebody else, and you're just faking the relationship like, wow, we are happy together, and in reality you're not. Both of you get satisfied elsewhere, but you're lying to each other, and you're losing and wasting your life together. And that is the fact of the matter now. We all know it, okay? Except maybe for very few. But that's what it is, and that's how it's supposed to be done. I hope I explained premature ejaculation very well. To summarize, there is a small medication involved for a specific period of time till you condition your brain, and believe me, you can stay half an hour. You can stay 15 minutes. You can stay as long as you want to stay. As long as she is not in pain, and she is responsive with you, you can continue as long as you condition. But if you do it silent and you have your own feeling heading and your own emotion heading, and she has her own feeling and her emotion heading, you don't talk to each other, expect disaster, the least of which you're going to get satisfied elsewhere. I think I'm clear on that, and I hope everybody understood that. Okay, so now let's move on. The following question: what is the impact of someone with low sperm count having sex continuously for a week? What is that? Okay, will he still produce the same quantity of sperms and quality? Obviously not. You know, if you have sex continuously for a week, that means he's saying not, I mean, like every day he has sex. Maybe he meant, I don't know, because it's not very clear. So he's having sex every day, and you know, he has low sperm, and he says having sex every day will affect the quantity of my sperms. Of course, that's why we demand everybody who wants to do a spermogram to have no sex for at least 4 days, then we'll come to do a spermogram, because the factory is not You see, this is how it works. The testes make the sperms, then the sperms get stored elsewhere. And when you get the urge to ejaculate, that storage contract, and boom, the ejaculate goes forward, normally forward to the vagina. In some pathological cases, it doesn't go forward, it goes backward to the bladder. That's obstructive, and that is azoospermia, no sperms. The seminal fluids are there, but the sperms are held back because of obstruction. And that can easily be diagnosed with an ultrasound or taking a sample from the urine, look for sperm in the urine, and you will be able to see it. I think, wow, time is already going, huh? So it's an interesting topic. I haven't even seen. So let's see. I see. So okay, we covered this. Doctor, my blood group is a negative, and my partner is a positive. Is this that's an incompatibility issue? Your blood and his blood are incompatible. Anytime the woman is Rh negative, the woman is Rh negative, and the husband is an Rh positive, means what? Meaning this is incompatibility. Why? You are negative, and now I'm giving you, through the baby, I'm giving you positive Rh, right? I'm giving you positive, because the baby has to be positive, no? I'm giving you positive Rh, okay? And you are negative. That means you will form antibodies against this Rh factor here. Yeah? And those antibodies will go then and attack the baby and causes hemolysis, destruction of the blood cells. So the problem is not like 50 years ago. Now it's very easy. You get an injection before you deliver, end of story. There is no problem. Yes, there is an incompatibility, but it can easily be solved. And anyway, before when you doing your antenatal care, we already know if you're negative or positive because you done blood grouping, right? So that's not a really an issue right now. Good evening, Mr. Leo. That's okay. Ronald, okay. Me and my wife and a child, second child is not coming. Okay, so that's an infertility issue, okay, and her menses are irregular. Her menses are irregular. I think we discussed that yesterday a lot, When the family put pressure on the wife, where is the baby? Why you cannot get pregnant? Look at this woman get pregnant, and look at that woman get pregnant. Why you not getting pregnant? This is too much stress on that wife. And too much stress inhibit ovulation. Okay, so she cannot ovulate when you nag over her head every day. She cannot ovulate because she's stressed out. Okay, so the infertility here, she is not ovulating because she's stressed out. So stop stressing her out. She will get pregnant. Okay, unless there is another cause that prevents the pregnancy. My advice to you: get evaluated. You will do a spermogram on you, and then the wife we look with ultrasound, see if there is any obstruction in the fallopian tube, any fluids around the uterus, indicating some sort of infection. So maybe we start with simple stuff first, and then we see. Okay, greeting doctor. This is Derek from Eastern. Okay, I have a problem. I have noticed that I don't stay up till 2 minutes with my wife. We just also easily discharge, and I am afraid it doesn't bring problems in my marriage. Please help me. This is the same thing we just discussed. See, a lot of questions around the same thing, fast discharge. Yes, it can cause problems. So, Mr. Derek, I will advise you to talk to the wife and apply the technique I have told you, and get that medication that I told you. It will be a jump start, and things will be much, much better between you and your wife, okay? Because I'm quite sure your wife is with you not only for sex, it's for sex and something else. So if we fix the problem with sex, the relationship will go wonderful. Okay, I noticed that since I was, that's another person, still a teenager, now I'm 35 years old, my wife and I are having a child, and by the grace of God, we are waiting for the second. That is good, congratulations. But I keep feeling embarrassed to the fact that I do not enjoy sex. So this is the man saying that, I don't know if the woman, she said, yeah, my wife and I, so I think he's the man. Is the man talking? Okay, yeah. So my wife and I. So that means he's talking about himself. So he said he doesn't enjoy sex. That means he's losing what? Desire. That means what about his testosterone? You're already a professional. All of you are professionals now on the topic. That means his testosterone is what? Is low. Does it mean I go buy a testosterone and shoot? You have to get your level of testosterone. It has to be calculated correct, and it has to be given on intervals that only the doctor knows. It's not like, or the doctor told me the secret, I'm going to go buy it. It doesn't work like that. All right. Good evening, doctor. Please, doctor, if are having sex with your husband and you don't feel the same thing, what could be the cause for that? So, if you having sex with your husband, now this is a woman talking. The previous one was a man talking. Now this is a woman talking, and a woman does not feel pleasure. That's an issue. This is also, I have another case, and the woman told me, a patient actually in the clinic, and she told me that she never had an orgasm in her life, and she's about 47 years old. She never had an orgasm in her life. She doesn't know what orgasm is. And why? You know, because she never got to that point. Because when I talked to her, she said, every time I start to feel the pleasure, it ends. So she is 47 years old, and she never had an orgasm in her life. Why? Because every time she is about to enjoy it, the man finishes. So there is no way she can have an orgasm. So maybe the woman doesn't enjoy it because of the man ejaculating fast. There is no chance for her to enjoy. But also, like the man, hormones affect the desire. The woman also, hormones affect the desire. So what is the solution to bring the desire back in a woman? Testosterone. Yes, testosterone. Also testosterone. But again, it has to be calculated, given by a professional who knows what he's doing. Another question, offensive discharge before menses. That is the question. I mean, I summarized the question. She has offensive discharge before menses. It doesn't matter really, because offensive discharge means trichomoniasis. That's a protozoa that is, and I also have another question. I remember that no matter what I get the treatment, then I feel again, I get the offensive odor and the discharge. Well, let me tell you something. If you get the treatment and the man did not get the treatment, you've done nothing. There is still, the man has to get the same treatment. When we see trichomoniasis meaning, let me not use medical terms. Let me cool down. If you have an offensive discharge, you must take treatment. First, we do a vaginal smear to confirm, but offensive discharge is only trichomoniasis, and the treatment is very easy and very cheap. Both of you have to take it, so you don't reinfect again. I think now they are signaling me my time is up, and still some of the questions has not yet been answered. Please send me your question to WhatsApp. I will summarize it, and I will be more than happy to answer them. I'm happy to be with you this evening, and please do have a nice, wonderful weekend. May God bless you all. Thank you.